There's many integrative therapies that can be useful in adjuvant cancer care. However, not all are appropriate for everyone. It's always important to consult a healthcare provider before undertaking a supplement program, especially if you have cancer. Topical aloe vera can help to heal mucous membranes damaged by radiation treatment for cancer. In one randomized control trial, 20 patients with rectal inflammation following radiotherapy for pelvic cancers were treated with either 1 gram of topical 3% aloe vera ointment or placebo twice daily for 4 weeks. The aloe ointment was more effective than a placebo at relieving the rectal symptoms and the related impairment. In another trial, an aloe vera mouthwash was as effective as a standard mouthwash containing benzdiamine, a local acting non-steroidal anti-inflammatory drug, at preventing the radiation-induced oral mucositis in patients with head and neck cancer being treated with radiation therapy. Oral mucositis, or inflammation of the mouth, is a painful and often severe side effect of radiation therapy in patients with head and neck cancer. Taking aloe orally may sensitize cancer cells to chemotherapy. In one randomized control trial, 240 participants with various types of metastatic solid tumors were assigned to receive standard chemotherapy alone, or with a 10 ml solution containing 300 grams of fresh, crushed aloe vera 3 times a day. The participants receiving the aloe solution had a partial or complete treatment response rate of 34%, where the participants who were treated with chemotherapy alone only had a response of 19%. In another trial, 50 individuals with untreatable advanced cancers were randomized to receive 20 milligrams of melatonin per day, alone or with 1 milliliter of aloe vera tincture twice a day. The survival rate after 1 year was 38% in the melatonin plus aloe group, compared to 15% in the group only receiving melatonin. Other research suggests that aloe may increase the absorption of vitamin C and E and prolong the time that they stay in the blood, and the effect could also benefit patients with cancer. Apigenin is a polyphenol and it's found in citrus fruits, celery, culinary herbs like parsley and thyme, and many commonly used medicinal herbs like chamomile, peppermint, lemon balm, and yarrow. It has well-known anti-inflammatory and antioxidant properties, and its demonstrated anti-cancer effects such as inducing tumor cell death, inhibiting tumor cell movement and invasion, preventing tumor cell proliferation, and stimulating the immune response in preclinical studies. In one clinical trial, patients who'd undergone surgery for colorectal cancer were monitored with follow-up colonoscopies for 3 to 4 years, while receiving either a supplement providing 20 milligrams of apigenin and EGCG catechin per day, or no supplement. An abnormal colonoscopy finding was found in only 7% of the patients who were receiving the apigenin EGCG supplement, compared to 47% of the patients who did not receive the supplement. Astragalus is a Chinese medicinal herb with a broad spectrum of actions that might protect against cancer. In vitro and animal studies suggest astragalus and its constituents may have anti-cancer effects related to their ability to increase the activity of tumor suppressor gene p53. In a 2003 study, outcomes in patients with advanced lung cancer receiving astragalus injections in conjunction with standard chemotherapy were compared with those of similar patients receiving chemotherapy alone. Patients receiving astragalus injections had a better response to the treatment, longer remission, a higher 1-year survival rate, and greater improvement in quality of life. A review of 34 trials with a combined total of 2,815 participants with non-small cell lung cancer concluded that the adjuvant treatment with the astragalus may increase the effectiveness of the platinum-based chemotherapy agents, improving tumor response and increasing the survival at 1 and 2 years. Similarly, a review of 17 randomized trials with a total of 1,552 participants found astragalus-based herbal adjuvant therapies improved the overall efficacy and decreased toxicity of platinum-based chemotherapy in patients with non-small cell lung cancer. Specifically, they found the addition of astragalus reduced the risk of death by 27%, 67%, and 70% after 1, 2, and 3 years of treatment respectively. A review of 29 studies evaluating the use of astragalus containing herbal preparations during radiation treatment for non-small cell lung cancer indicated astragalus may decrease the radiation toxicity, improve its effectiveness, and increase the likelihood of survival. Carotenoids are yellow, orange, and red plant pigments and are found in high concentrations in colorful fruits and vegetables. The carotenoid family includes more than 700 compounds, about 50 of which are normally found in the diet. Some carotenoids, like alpha-carotene, beta-carotene, and alpha-cryptoxanthin, are referred to as provitamin A carotenoids because they can be used to make vitamin A in the body. Vitamin A is needed to protect the fatty tissues and the lipid molecules from oxidative damage. Other carotenoids like lycopene, lutein, zeaxanthin, and astaxanthin are not converted to vitamin A, but they have their own anti-inflammatory and free radical scavenging properties. Carotenoids have demonstrated anti-cancer properties both due to and independent of their effect on vitamin A status. Numerous studies have indicated eating a diet high in carotenoids is correlated with a lower risk of several types of cancer. While vitamin A is toxic to the liver when taken in large doses, provitamin A carotenoids are not. Absorption and conversion of carotenoids into vitamin A appears to be carefully regulated, and excess carotenoids are stored in the skin. Very large amounts can cause a harmless yellow-orange skin pigmentation, visible mainly in the palms and the soles. Because carotenoids are fat-soluble, their absorption is increased when taken with dietary fats. Astaxanthin is a carotenoid that's particularly concentrated in microalgae and the marine organisms that eat them, such as salmon, shrimp, and crab. Astaxanthin has demonstrated anti-cancer effects against a variety of cancers in vitro and in animal models. Astaxanthin reduces inflammatory and oxidative cell damage, and it can induce tumor cell death. It's been shown to inhibit NF-kappa B, an inflammatory molecule involved in malignant cell activities. Astaxanthin may also help to prevent tumor progression by interfering with other cancer cell proliferation signals, improving dysfunctional intracellular communication, and inhibiting enzymes that break down extracellular material and allow for tumor growth. Additionally, astaxanthin has multiple beneficial effects on the immune system, boosting the function of natural killer cells that patrol for cancerous cells. Lycopene is a carotenoid found mainly in tomatoes and tomato products, but is present in other pink and red fruits like watermelon and pink grapefruit in smaller amounts. Higher tomato consumption and high blood levels of lycopene have been associated with a reduced risk of prostate cancer, as well as a range of other cancers. Findings from animal and lab research suggest lycopene has multiple anti-cancer effects, including interfering with cancer cell proliferation, promoting cancer cell death, decreasing inflammation, inhibiting new blood vessel growth, and preventing metastases. A number of clinical trials have investigated the possible benefits of lycopene as an adjuvant therapy in men with prostate cancer. A preliminary trial included 20 men with metastatic prostate cancer that was progressing despite the prior treatment. Participants received 10 milligrams of lycopene daily for 3 months. One participant achieved a complete response, which was defined as a reduction of the PSA to less than 4 nanograms per milliliter, and the absence of any sign of the disease for at least 8 weeks. 6 had a partial response defined as a 50% reduction in the PSA and the alleviation of bone pain if present. 10 had disease stabilization, and 3 had progression of their cancer. Importantly, 10 patients with bone pain were able to reduce their daily use of pain-suppressing drugs. In a randomized control trial, 15 men with prostate cancer received 30 milligrams of lycopene daily for 3 weeks prior to a prostatectomy, and 11 similar men who were untreated for 3 weeks before the surgery were included as controls. The lycopene appeared to have positive effects during the pre-op period. Prostate samples revealed that the cancer had spread beyond the prostate in 82% of the controls, but only 27% of the men taking the lycopene. Moreover, tumour volume was less than 4 mils in 84% of the lycopene-treated men, compared to 45% of the controls. Another trial included 54 participants with metastatic prostate cancer who had undergone surgical removal of the testicles to eliminate testosterone stimulation of their cancer. Half of the participants were given 4 milligrams of lycopene daily for 2 years, and the others were not. At the end of the trial, 78% of the men receiving lycopene had a PSA level below 4 nanograms per mil, compared with only 40% of the men not receiving lycopene. Additionally, the lycopene group had a higher survival rate than the control group. In a study in 71 men with rising PSA levels after initial treatment for prostate cancer, 30 milligrams of lycopene per day, with or without soy isoflavones, led to stabilization of the PSA levels in most participants. A clinical trial that examined nutritional interventions in 79 patients with prostate cancer determined that cancer's aggressiveness and an individual's ability to absorb and maintain high levels of lycopene in the blood were factors that influence the effects of lycopene. The participants consumed either tomato products containing 30 milligrams of lycopene per day, the same tomato foods plus selenium and omega-3 fatty acid supplements, or a usual diet for 3 weeks before the prostatectomy. A positive effect of the 2 intervention diets on the PSA levels were seen only in the men whose surgeries revealed non-metastasized cancer, and men with the greatest increases in blood levels of lycopene, and the effect was more pronounced in men who also achieved the highest levels of selenium and omega-3 fatty acids. Another carotenoid, beta-cryptozanthin, can also promote prostate health. A recent study looking at dietary intake of lycopene and beta-cryptozanthin showed higher intake of either was correlated with less aggressive prostate cancer. A clinical trial examined the effects of oral lycopene supplements in patients with advanced brain tumours known as gliomas. The study participants were randomized to receive radiation therapy, along with either 8 milligrams of lycopene daily or placebo. After an average of 50 weeks, 28% of those in the lycopene group achieved a complete response. 16% achieved a partial response, but in the control group, only 8% achieved a complete response, and another 8% achieved a partial response. It was further noted that the time to progression was longer in the lycopene group than in the placebo. The authors concluded the lycopene may have therapeutic benefits as an adjuvant therapy for managing high-grade gliomas. Lycopene may reduce the toxicity of other cancer therapies. In a trial that included 120 patients receiving the widely used chemotherapy drug cisplantin, the addition of lycopene at a dose of 25 milligrams every 12 hours, beginning 24 hours before and ending 72 hours after receiving the cisplantin, preserved some markers of kidney function compared with cisplantin treatment alone. Kidney toxicity is a potentially life-threatening side effect that frequently limits the use of cisplantin. The safety of beta-carotene supplementation in people at high risk of lung cancer came into question in the 90s. The concern stemmed from 2 large studies examining the possible protective effects of beta-carotene supplementation in individuals at high risk of lung cancer. One of the trials, known as the Carotene and Retinol Efficacy Trial, or CARET, was conducted in the US, and it compared 30 milligrams or 50,000 international units of beta-carotene plus 7.5 milligrams or 25,000 units of vitamin A as retinol palmate with a placebo in current or former smokers and asbestos-exposed workers. The study was halted early because of a 28% higher rate of lung cancer and a 17% higher rate of death in the group taking the beta-carotene and vitamin A. The other trial, known as the alpha-tocopherol beta-carotene or ATBC cancer prevention study, or the Finnish smoker study, was conducted in Finland, and participants in this study were male smokers, and they received 50 milligrams or 75 international units of vitamin E as alpha-tocopherol, and 20 milligrams or 33,000 international units of beta-carotene, the two combined, or a placebo. Vitamin E had no effect on lung cancer incidence, but beta-carotene was associated with a 16% increased risk. Monitoring participants after termination of these trials revealed the negative impact of the beta-carotene supplementation on lung cancer risk may have persisted for as long as 3 years after stopping the supplements. The findings from these trials suggest excess beta-carotene from supplements may interact with known carcinogens like smoke and asbestos in ways that exacerbate their cancer-promoting effects. Research has since found that beta-carotene can in fact exert DNA-damaging pro-oxidant effects in lung tissue already under a high degree of oxidative stress due to immune cell activation. Nevertheless, a high intake of carotenoid-rich food continues to appear to be safe and cancer protective. A follow-up analysis of the data from the CAR-ET showed the higher levels of fruit and vegetable intake had a protective effect in participants randomized to a placebo group, but not to the supplement group. In another study, dietary intake of beta-carotene, alpha-carotene, beta-cryptozanthine, and lycopene were correlated with a lower risk of lung cancer in male smokers. A meta-analysis of the studies concluded higher blood levels of total carotenoids, alpha-carotene, beta-carotene, lycopene, and vitamin A, are each associated with lower lung cancer risk, but could not draw conclusions about differing effects in asbestos workers or smokers versus the non-smokers. Until more is known, it's prudent for smokers and others at high risk of lung cancer to avoid supplementing with large doses of beta-carotene. Multivitamins generally contain beta-carotene in safe doses, ranging from 1/10 to 1/100 the amount used in these studies. For more information on adjuvant cancer therapies, check out the next video in the series. And for more information on herbs, supplements, and natural treatment plans, check out my website.